So you found out you have a tumor and it's malignant. Now you're trying to make decisions and figure out what to do about it. What I'm going to try and do in this video is explain what tumor sensitivity testing is and how you can use it to make accurate treatment decisions to find out what your tumors are sensitive or resistant to as far as therapies are concerned. My name is Dr. Ryan Best. I'm a naturopathic doctor at Nirvana Naturopathic Medicine. What tumor sensitivity testing is and why it came about in the first place is, for decades, typically conventional approaches will recommend treatments based on where that tumor originated. So breast cancer has very specific types of treatments for breast cancer. Colon cancer, the same. You can pick any cancer, and those therapies are standardized based on where that tumor arises. What we're learning now in the last couple decades is that precision medicine is starting to change the way that we look at choosing therapies for cancer patients. You can have 100 different cancer patients in a room that have been diagnosed with the same stage, same grade, and same type of cancer. And when we start to run deeper analysis on that, when we run mutational profiles and genetic information on those tumors through a biopsy sample or through liquid biopsies, when you start to look at that in combination with the lab work and the way that those tumors are presenting on imaging and other testing, we start to realize that those patients have drastically different tumors, even though all of them will be called colorectal cancer or breast cancer or any type of cancer that you've been diagnosed with. The reason why that's important is because if your tumors, and almost everyone's tumors, act differently than other people's do, if those tumors have expressed different genetic mutations inside them, or different types of profiles to hormone sensitivity or sensitivity to other therapies, that will drastically change how your cancer and how your tumors are going to respond to therapy. And that applies across the board, whether we're talking about chemotherapy options, radiation options if you're sensitive or resistant to it, immune therapies or white blood cell-based therapies, nutritionals and nutraceuticals, even dietary approaches can be affected by these different types of genetic mutations that may or may not be present inside your tumors. The great thing with that is after the last decade, we now have some very accurate testing that we can run to take a detailed look and determine what type of profile your tumors have. Not just what is breast cancer may be going to respond to, what are your tumors sensitive or resistant to? So how does that testing work? What it typically looks like, depending on the type of cancer that we're dealing with, it'll be a combination of either solid tumor biopsy pieces. Now, everyone who's had a biopsy done at a cancer center, they freeze and they store those biopsy samples, the slices of solid tumor that they put basically in wax, and they keep them cryo-frozen and they keep them for years that way. What we can do is we can requisition those and have those solid pieces sent off to these third-party labs to be analyzed for resistance and sensitivity to different types of therapies, conventional or integrative. The second piece that goes into that is using what we call liquid biopsy sensitivity information. Liquid meaning blood in this case for most cancers. There are some exceptions. There's these cells that float around in the bloodstream called circulating tumor cells. And almost every patient who has a solid tumor will have some of these cells circulating in their bloodstream. What these cells are, we couldn't figure out for years why people would have their solid tumors removed or killed with various types of therapies. They're technically in remission or cured from their cancer. Then 2 years, 5 years, 10 years, or 2 decades later, they get a recurrence of a cancer that pops up with a similar mutational profile to the original tumor. How can that happen if the tumor was removed or eliminated? And what we learned in the last decade, it was these circulating tumor cells that we didn't know were there before. These cells bud off of the solid tumors, they float and circulate and stay in a state of something called quiescence, where they're basically asleep. And they float around in the bloodstream until they get the right opportunities to try and colonize in a different tissue. That can happen weeks, months, years, or decades later as well too. These cells are good at surviving. It's a defense mechanism that a living disease like cancer has learned how to evolve. So what we can do with that is we can detect those cells now with very accurate lab equipment that can extract them from a blood sample that we draw in the clinic. We send that off to the third-party lab, and what they do is they give us a count. They give us a number for how many of these are present in a certain amount of milliliters of blood. And for most of the common cancers that happen now, we actually have validated numbers where we can look at the level of those cells that are found in that sample, and that can give us very accurate information on, number one, how likely are you responding to the current treatment regimen that you're using right now. Number two is it can give us really good information about helping us predict survival ratings for your cancer. Are you more or less likely to die from your cancer just based off of that number itself? The third thing that we can use is we can use it to track over time, and we'll rerun these tests every 6 months for most active cancer patients, because watching those numbers start to come down as far as circulating tumor cell counts is validated in a lot of solid tumor cancers to tell us that you are responding to therapy and you are much more likely to survive longer in compared to people that don't get those reductions in those numbers. Now some of the stuff that we can do can take it a step further. And what we can also do is take those circulating tumor cells, we can run a genetic mutation analysis on them, and we can test sensitivities and resistances to over 150 different chemotherapy agents, to immunotherapy agents, to targeted therapies that you might be offered through conventional care. We can test various nutraceuticals, off-label medications, and more different therapies. And again, take some of that guesswork out and say, we think that this might help some people with your cancer, and move that step further and say, your tumors, not just anybody's tumors, your tumors are sensitive to this, which means they are much more likely to respond and be damaged by it. That's where precision medicine is heading with integrative cancer care, and it's something that I do for a lot of my patients to guide them through. So I hope that's helpful for you. If you found that this video was helpful, you can leave a comment if you have any questions below, or share it with someone that you feel that it might be interesting to. If you're interested in learning any more about this testing, click the link below and you can book in a consult with me.